Hi everyone, it's Dr. Hall, and here is my attempt to give you some understanding of current events as they relate to health insurance and healthcare systems. It is currently November 8th to 2025. I always have to record these a couple weeks in advance so that I can get the materials up in case you guys want to work ahead. So by the time you actually watch this, I have no idea what will have happened, but hopefully this gives you some useful context for our current events. So first, I just want to remind you of the definitions of all the different terms that we use for health insurance. I just realized I didn't put premium on here. Premium is that monthly bill that you pay and or that your employer pays so that you can have health insurance. It's your kind of monthly fee for having that health insurance. And then there's a whole bunch of different types of cost sharing. Cost sharing means that you, as the patient, are responsible for some portion of the money that is needed to pay for your health care. So whether that be a copay, which is a flat amount, say every time I go to the doctor for a regular office visit, I have to pay $25. Or if it's a percentage of the total bill, that's usually called co-insurance. So it will often be, sometimes it's 0% of primary care and 20% of an emergency room visit, or 20% of primary care and 50% of lab tests. It can vary a lot depending on the plan. The deductible is the total amount that you have to pay out of pocket of your own money before the insurance kind of kicks in and starts contributing. So right now I'm on what's termed a high deductible health plan. My deductible is $1,600, I think. So until I pay that, my insurance doesn't really pay for anything except for some of the things that the Affordable Care Act mandates that it covers. So you might remember a screening mammogram is an example of that. A lot of times an annual physical exam, a pap smear, routine vaccinations that are recommended, which is why what vaccinations are recommended by federal agencies is actually really important because it helps determine what insurance companies have to pay for. Those you don't have to pay for even if you haven't met your deductible, but otherwise until you meet your deductible, you are paying for things out of pocket. But then there's usually a maximum out of pocket where once you've paid that much money toward your healthcare expenses in any given year, then your insurance is going to start picking up the rest. So just a reminder on those. Next, I want to address this myth that you'll hear some politicians say that the Affordable Care Act isn't working. It's a mess. It's not working. Healthcare expenditures keep going up and up and up. So therefore, this bill was a failure. Yes, absolutely. As you've already seen, this unit healthcare expenses in the United States keep going up and up and up. And we talked about the reasons for that. So the Affordable Care Act by itself was never going to be able to keep healthcare costs down because it doesn't address all of these things that we talked about, from the aging population, right? We have just a booming population of people who are over age 65 and they are on a lot of medicines and they have heart attacks and they get pneumonias and have strokes and all kinds of things that require expensive medical care. We also have more expensive treatments, right? So Ozempic is really expensive, but it's also really effective and can really improve somebody's health. Some of the new biologic agents for cancer are amazing, mind-blowing. Cancers that used to be really fatal now are highly treatable. It's amazing, but they're hundreds of thousands of dollars. So we have new technologies. They did this weird radio tracer thing when they did my breast surgery. So there's all kinds of technologies and things that are amazing and wonderful, but also more expensive. And then, of course, we have a very market-driven system. Now, remember, a lot of hospitals are nonprofit. A lot of physician groups are nonprofit. They're just trying to recoup their costs and not go out of business. But certainly the pharmaceutical companies, the health insurance companies, those are all for-profit companies. And so they're going to charge as much as they can, right? That's how you make money in a market-driven system. And when it's somebody's life and health that's on the line, a lot of times they will pay quite a lot of money. We also, in our system, don't have a lot of bargaining power. So when we looked at the single-payer health systems like the UK or Canada, that's, they're responsible for buying all the drugs for everybody in their country, so they can negotiate with pharmaceutical makers about what prices they're going to pay. Now, remember, there was a law passed that in 2026, our federal government is going to be able to start negotiating for Medicare, Medicare recipients some drug prices. Now, whether they choose to do so or not, depending on what administration we are dealing with and what their priorities are, we will see. And then we also don't have price control. So there are actually some countries that have rules and regulations about how much a pharmaceutical company or a health insurance company can charge you. And that is not something that we have. And then remember, in the United States, we're also unique in that we have a lot of administrative costs associated with billing these healthcare insurance companies, which are, on average about 15% of the overall cost of healthcare on the hospital and clinic side. So that costs us a lot of money too. So the Affordable Care Act there was a hope that it would help keeping costs down for reasons that hopefully will become clear later if they aren't already, but it never by itself was it going to be able to address these other things. But the ACA did meet its primary goals. So the goal was to decrease the number of people who didn't have health insurance. And as you can see in the graph on the left, from before and after passage of the Affordable Care Act, you can see, so here's when the ACA was implemented, and these are the number of uninsured individuals. Now this looks at non-elderly, so folks age 0 to 64, because 65 and up, you can get on Medicare. And then just look at this huge drop. Right? So people were able to get health insurance through the marketplace, through healthcare.gov, and there were systems in place to make it affordable and to kind of basically make it what's the term? I can't remember, but where it's like based off of your ability to pay, right? So based off your income, like a sliding scale. Right? It also decreased the number of people that had medical debt and the number of people who were declaring bankruptcies due to medical expenses. So the Affordable Care Act actually has been successful in meeting its goals. It also has done a lot of other nice things like making preventive care free, and you don't have to pay your deductible to get that mammogram or that pap smear or that colon cancer screening. And it allows young people to stay on their parents' health insurance until they're 26. So there's a lot of good things that came from that bill. Is it perfect? No, but it did a lot of good things and still does. All right, so it looks like I'm part of this family. So I'm going to give you an example of somebody who traditionally has benefited from the Affordable Care Act. So Maggie is a hypothetical fictional 28-year-old single mom who works full-time, earning $15 an hour, which is about $28,000 a year, about $2,400 a month, and that's like total. So that's not taking out Social Security and other taxes and things. So take home would be even less. Who has 2 young kids, as you can see here. Okay, so you're like, wait a minute, we saw this slide before. Yes, because now I want to take a moment to remind you that in the previous part of the lecture, I talked about the Inflation Reduction Act, which was passed in 2022 by Congress, that allowed Medicare for the first time to negotiate, which was very exciting over drug prices. But the other thing is that it had these subsidies. So Affordable Care Act was from way back in 2010, and the Inflation Reduction Act in 2022 expanded subsidies to help pay for health insurance through healthcare.gov for people who were low income. So if you were like 100 to 250% of the federal poverty limit, then you could get some financial assistance, depending on your situation, to pay that healthcare premium, that monthly cost. Okay, so let's come back to Maggie then. So in 2025, let me just tell you, so that's how much she makes, and let's just say that she only makes $15 an hour. That's not bad, but it's not the best. You might think, well, she should get a better job, and I'm going to tell you, she works that job because she works for a small daycare, and they let her kids be in daycare for free. So that's a huge benefit. So she only makes $15 an hour, but her work doesn't offer health insurance. They're a small company. They don't offer health insurance. So she doesn't have that. So she's going to get health insurance and has been getting health insurance through the Affordable Care Act at healthcare.gov. And in 2025, I happened to put in these numbers for a different reason. And if you were Maggie in 2025, you could get what's called a silver plan for $0 a month, because with 2 kids and working full time, and that's your income, the federal subsidies were going to cover the cost of your monthly premium. No deductible, no copay for primary care, no copay for generic medications, which is all wonderful, right? So, when she had to take her little girl in for her well child checks and to get her routine vaccinations, she didn't have to pay for any of that, which is great because we want people to do those things that keep them healthy. When her son needed office visits to diagnose and treat his asthma and needed prescription medicine for his asthma to control it, that's all covered. That is wonderful. We want people to be healthy and doing well in our community, right? Now you'll notice, however, there are some things for which she does have a partial cost. So we're going to come back to that. I think it's the next slide. We'll see. Yes. So let's say her son, let me point it out. So for ER visits, lab, and x-ray, that plan required her to pay 25% of the cost. So let's say her son's asthma gets really bad one night. Maybe he has flu or he has a cold or he has something else. And so he has a really bad asthma exacerbation in the middle of the night. He can't breathe. She has to take him into the emergency room. He got some nebulizers and some other treatment. And thankfully, he does really well. So that's great. So it turns out that the bill for that is $1,500. Now that's actually based on an average bill from 2014. So it could be a lot higher now. And at 25% of cost, her portion that she has to pay then is $375. So we know that about 37% of Americans, as of data from 2024, which was just published in 2025 this year, 37% of Americans do not have $400 in the bank to pay for an emergency should it arise. And I would certainly imagine that Maggie is probably one of those people, right? So then you're looking at putting out a credit card, not paying the bill, having it go into collections, right? And then all of the negative ramifications that can come from those things. All right, so that was 2025. Now that the subsidies are expiring at the end of 2025, things are different for 2026. So I went to healthcare.gov and I put in the same numbers for Maggie that I did last year. And this is the cost. So for what's called a silver plan, which is kind of the medium level plan, it's about $1,500 a month, which is more than half of her take-home income. The deductible is $12,000, which means that aside from routine preventative care visits, vaccinations, any other office visits, or ER care or anything that she needs or that her kids need, she's going to have to pay the first $12,000 of that out of pocket. And when she does go in for a primary care visit, it's $40 for those well child checks, which you do several of in the first year of a kid's life. And that inhaler for her son, well, that's going to cost $20 a month. And if he ends up needing to go to the emergency room, well, now it's 40% of the cost that she's responsible for. And that's after paying a $12,000 deductible. For someone with this level of income, this might as well be no insurance, right? So, a $12,000 deductible is absolutely prohibitive, and yet that's what people are looking at for this next year. You might say, well, what about like a lower tier plan? So I looked at a bronze plan, and it would cost $1,200 a month and has a $21,000 deductible, right? So with deductibles like this, these plans are only good like if you have a horrible car accident or a cancer diagnosis or something like that that's going to cost you tens and tens and tens of thousands of dollars, then it's going to be worth it. But of course, none of us know if that's going to happen. So how many people are in this position? So currently 20 million Americans are using these subsidies through the Affordable Care Act, through that Inflation Reduction Act. And so 20 million Americans have subsidies that are expiring and they will no longer have access to affordable care through healthcare.gov. Due to, so you see I put on it, due to the One Big Beautiful Bill Act, so the bill that Congress passed in July 2025 specifically chose not to renew the subsidies and to let them expire. That was an intentional choice. So imagine, right, Maggie can't afford that insurance, right? She can't pay $1,600 a month, and even if her $1,500, and even if she could, it wasn't going to do her any good anyhow with a $12,000 deductible. So she's going to go without insurance, as are millions of other people. That is the the most prudent response to this. So what that means when you don't have insurance is now maybe you're going to wait until your kid is even sicker and you're like, oh, no, I really need to take them to the doctor, right? And of course that's worse for the child, that's worse for the sick person, but also then by that point care might be more expensive. Maybe then he has to be admitted to the hospital for his asthma, and maybe he's going to be in the hospital for several days, and that's going to be more expensive. She may go into debt to pay that bill, which comes with all of the problems, is because it's that she's unlikely to ever be able to pay, or she may just not pay it, right? Which then it goes into collections, which impacts her credit rating and can lead to bankruptcy and all those types of things. So there are significant negative impacts of not having accessibility of healthcare insurance for low-income folks on those individuals, especially on their health, right? And think about the mental and emotional stress of this, right? But then there are also, just to be a little bit kind of Machiavellian about it, there are impacts on the whole entire system. So when something like this happens, people who are generally healthy tend to opt out of purchasing insurance. So that means the risk pool, the people who then have insurance, are sicker proportionally, and so the cost per person then ends up being higher. So what that does is it drives up healthcare premiums for everyone else, because the insurance companies still have to make their profit and they're spending more money on healthcare per person for all the people who are in it. We also know that, of course, when people don't pay their bills, right, if somebody's not able to pay the hospital, then the rest of us get charged higher, right, to make up for the fact that those bills aren't being paid. So we're all paying for everybody else's healthcare one way or another. But then, of course, you have more bankruptcies, you have more people in debt and with bad credit, which then impacts their lives negatively in many ways. And we're going to have sicker people. So that's what we see when people don't have access to healthcare. So as you know by now, right, this is the main actually at this point in time sticking point behind the government shutdown. So because no extension was passed, and then when there was an opportunity for the Democratic folks in Congress to have some power, because no regular budget was passed, so then they had to go to a continuing resolution, which requires 60 people. And so Democrats were able to say, well, no, we're not going to agree to this continuing resolution to fund the government unless you, and they initially said you need to extend the subsidies permanently and reverse the planned Medicaid cuts from the July 2025 bill. And the Republicans in Congress said, no, absolutely, we won't do that. The shutdown is incredibly painful, the lack of SNAP benefits. As of today, the Supreme Court just upheld the federal government's ability to refuse to pay SNAP benefits. So people are going hungry. And just yesterday, a bill was introduced in the Senate to say, all right, let's just agree to extend the subsidies for 1 year, just 1 year, and forget, we'll let you cut all that money from Medicaid. Let's just extend them for 1 year and then try to come up with a long-term solution and reopen the government. And that was shut down. So there's an unwillingness to negotiate and unwillingness to compromise. And House of Representatives has continued to extend its recess, so they're still not coming to Washington to work. So this is not in line with what the American citizenry say they want. So when you survey Americans, most people agree with the subsidies. Most people think it is a good idea. 75% approximately of Americans want the Affordable Care Act subsidies to continue. Marjorie Taylor Greene was even very vocal about this. So across the political spectrum, although certainly more in one party than the other, we definitely see differences by political affiliation, but overall 75% of Americans want these subsidies to continue. So this is an extraordinarily unusual situation that we're in. I'm old enough that I can tell you this is not normal. for Congress to refuse to compromise and to refuse to negotiate, even though that refusal is causing significant harm to their constituents in terms of federal employees not being paid, all the flight delays that we're seeing, the lack of SNAP benefits, families going hungry, all these types of things. This is a new era in American politics. So, as we think about health insurance and healthcare systems, these are extraordinarily important for the well-being of our individual selves, as well as for the well-being of our communities and the health and well-being of our populations as a whole. So, I hope you will enjoy the documentary and start thinking about what are some ways we could maybe do things differently that might work better for all of us. All right, things to think about. Thanks.